Everybody ready? Excellent. Well, good afternoon. My name is Michael Loy. I'm the Chief Executive Officer here at North Central Healthcare, and it is my extreme pleasure to welcome our 46th Governor of this great state of Wisconsin, Tony Evers.
Thanks so much. Appreciate it. Thanks everybody for joining us. I'm sorry, just a little late, but a real important announcement today. Just about 3 months ago, I delivered my second budget speech to the state of Wisconsin, and when I did, I talked pretty much at length about the issue of elected officials trying to sell this budget as a false choice. You know, things like that we have to choose between making healthcare accessible and saving money. That we have to choose between funding our schools and cutting taxes. That we'd have to choose between supporting our farmers and our rural communities and protecting our natural resources and creating jobs. That we have to choose between building a future that we want for our kids and our state and making sure that we recover from a pandemic. And I'll say today what I said back then, we don't have to choose. We do not have to choose. They're wrong then and they're wrong today, because we can and we should do both, and that's why we're here today. A few weeks ago, we learned that we'll be getting $700 million less in federal funding through the American Rescue Plan. So now there's even more urgency to do everything we can to ensure that our state has the resources to bounce back and our economy can recover from the pandemic. But here's the bottom line: we can't let politics get in the way of doing what's right and what's best for the state of Wisconsin. It's time to put people first and focus on what's fiscally and morally responsible to improve the health of the people of Wisconsin and our state's bottom line, because we can do both. A few weeks ago, Republicans drew a line in the sand and once again threw out the Badger Care expansion out of my budget, ignoring the will and the interest of 70% of the people of Wisconsin who support expanding Badger Care, and leaving billions of federal dollars on the wayside. Obviously, we weren't horribly surprised. They've done that before, but the thing is, folks, this time it's different. This time, if we don't expand Medicaid or Badger Care, then we're just not missing out on the opportunity to access to quality, affordable health care, but we're also missing out on an additional $1 billion, that's with a B, $1 billion under the American Rescue Plan. That is available to those states, and we're one of them, that haven't already expanded Medicaid. That's money that we could use to ensure our economy can recover from this pandemic and bounce back better than we were before. So today we're announcing a plan to do just that. Earlier today, I signed an executive order, number 116, calling a special session of the legislature on Tuesday, the 25th of May, to take up LRB 3658. We're not only going to expand access to health care for tens of thousands, about 90,000 people in the state of Wisconsin, but we're also going to use that $1 billion that we saved and put it towards economic development projects in every corner of the state, whether it's from Superior to Darlington, Eau Claire to Manitowoc, Racine to Wausau, and every place in between. We're going to invest in these savings that we realize by expanding Badger Care and invest into more than 50 projects across our state. And we're starting here in Wausau with a $5 million grant to provide additional mental health beds right here at North Central Hospital. We're going to re-energize our economy by investing in job training and education to reskill and get people back to work, such as we're going to start by establishing a technical college farmer tuition incentive system program and building. In addition, a new manufacturing engineering apprentice center at Mid-State Technical College. We're also going to bolster our infrastructure with investments for roads and bridges to broadband, with $100 million for local governments for bridge and road repair, and put $200 million to continue our work because of the year of the broadband access to expand broadband across our state. We're also going to invest in our paper and ink industries that have carried our state for generations by providing $75 million in support to 2 major paper mills, including Verso right down the road from here, that will save more than 1,000 jobs in the state. We're also going to invest in our rural communities and ag industries with $400,000 for the Wisconsin Cranberry Research Station in Black River Falls, and $5 million for a new food and farm exploration center to provide hands-on education experiences and job training in Stevens Point. We're going to invest in some of our most valuable resources, our natural resources, which we know because of the pandemic, how important it plays a role not only in our outdoor recreation, but in the health and well-being of our communities. We're going to do that by investing $5.4 million in the stewardship programs from Dunn County to Egg Harbor and more, and $113.5 million to address PFAS, lead laterals, and to ensure access to clean drinking water across the state. So I get it. I just talked about a number of things that on this list, and it does sound like a lot. It's because it is a lot. We have to work to ensure our state and our economy can bounce back, but we have a plan to do it now. It's time for Republican leadership to put politics aside and recognize that this is a great deal for all of us. This $1 billion is not going to come our way again. We need to work together to invest in our economic recovery and development so that we can bounce back from this pandemic. So it's time, folks. Enough politics. Let's get this work done. So with that, I'd like to now hand things over to Dr. Guthrow. Doctor.
Hi. Hello, I'm Robert Guthrow. I'm the Chief Medical Officer for North Central Healthcare. And this is a difficult time. Finding the resources to provide appropriate mental health, high quality mental health care to places or to people in rural areas has always been difficult. So this news today is very welcomed, and we thank Governor Evers and his administration for this. North Central Healthcare has been working to change the way we do business with people in stress and people in need. We've known that we've not had enough of the resources, of practical resources such as people and financial resources to do what we do alone. So we reach out to other partners. 4 years ago, the Medical College of Wisconsin and North Central Healthcare partnered with other organizations in the area to create a psychiatric residency in order to train physicians in the areas where we hope they'll stay and train. And I have a few of the physicians standing here on the side. This year marks the first year that we will have graduates from our program joining the workforce here in central Wisconsin. Of the 7 graduates between the 2 rural programs that we have partnered with, we will have 6 staying in areas of need for care. North Central Healthcare also realized it has to transform the way we do things here. About 4 or 5 years ago, we started large initiatives to put investment into the services that we offer as well as the facilities that we have. It's hard to think about that just a few months ago, if a youth had a behavioral health issue, they would actually have to travel 1.5 hours or more in order to seek inpatient psychiatric care. We opened a new youth behavioral health hospital here that is able to meet that need so families and youth no longer have to travel and bear that burden during times of difficulty. This June, we're starting construction on a new emergency ER, crisis center ER, to deal with our patients when they're at their most vulnerable. And we're going to transform the way we reach out to patients, meeting them where they are and going into the community to ensure that we can help them stay safe and healthy where they are and not need escalated services from an organization like ourselves. We're also building a brand new inpatient hospital and detox center. We are focusing heavily on alcohol and addiction and opening a new residential center and 5-bed detox center, which is something this area is greatly missing. We greatly appreciate that Governor Evers has put a stronger focus on mental health. This is something that is greatly needed for all of Wisconsin, but especially its rural areas. And we look forward to working with the other organizations in the area and keeping the region safe and healthy, and thankful that the tools are being provided to us to help us be successful. Thank you, and I'd like to introduce Mayor Katie.
Thank you so much. Governor Evers, welcome to Wausau.
Good to be here.
Welcome to Marathon County. Welcome to North Central Healthcare. This is my favorite multi-million-dollar investment that I ever had the opportunity to vote on. You see the cranes out there. I'm so proud of the work and the investment and the leadership that Chair Gibbs and Executive Director, CEO Michael Loy have put into this. The county and our community is putting the effort in and the capital behind it. And now we need legislators to act. We need to be able to pay those reimbursement rates for our leaders here. We need to be able to service as many people as possible. I'm so proud that Wausau and Marathon County has this resource here, and mostly because when I talk to leaders in other communities, especially up north, other rural areas, they're in healthcare deserts, especially mental health care deserts. So it's really important that we're servicing our communities and our most vulnerable people. And as we've seen over the last year, more than a year now with the pandemic, mental health care is so important. We've been alone, we've discovered our inner demons, and we're committed to working on that with our community. So I just want to thank you for pushing us to invest more in healthcare, mental health care, behavioral health care, and I'm just so pumped to be the recipient of this. So whatever we can do to be good partners, I know that the legislators that represent us here in Wausau and Marathon County, I don't think we can argue over the fact that we need more mental health and behavioral health care. So I would challenge them to support this with us. We'll be there with you, we'll support this. So thank you so much. Thanks for being here, appreciate it.
Thanks, ma'am. So it's all good news. I'd be glad to answer any questions you may have.
Specifically, you mentioned that there's money in here. You're proposing money for the Verso paper mill in Wisconsin Rapids and the one in Park Falls. Just talk about how important that is and what you hope to accomplish if this $50 million can indeed be used for that purpose.
Yeah, that's a great question, a real important one. Paper making is a really important part of Wisconsin's history, and obviously, not just the pandemic, but people's use of paper has changed dramatically over the years, and so these mills really need to, change the way they operate in order to survive economically. And both in Park Falls and in the Verso mill and Wisconsin Rapids employ lots of people. That is really important. But the additional thing, and we've proven this with Wisconsin Rapids and Verso, is the supply chain of people that are involved with timber management, cutting, transporting, all those things. And it's just a huge number of people for Wisconsin. So both of these mills need some help, and in order to continue doing the great work they're doing. In addition, the Verso plant obviously is for sale, and there's a co-op of supply chains folks, whether it's loggers or folks that are delivering the material to the plant. They've formed a co-op, and if things work out well and we have the money on the table to make that change and make that a reality here in central Wisconsin, that'll be a huge win for all of us.
So what is the committee set to meet today to discuss rolling back some of those pandemic unemployment provisions? What are your thoughts on the potential for that rollback, and is that something you would sign off on?
Well, I haven't seen the bill, so I won't say for sure, but I do have great empathy for people that are on unemployment. Especially because of the pandemic. So I'm not sure taking the theory is that somehow by taking those things away, magically there's going to be all these people who go to work. Well, frankly, we had that problem before the pandemic. We had a shortage of people living in the state of Wisconsin, workers that are, that our industries need. So I'm not sure this is the answer. I've always believed, and I think a lot of people in economic development agree with me, is that if we want strong economic development, strong state as it relates to that, we have to have a high quality of life. That is something that draws people to an area, draws people to a state, whether it's schools, whether it's affordable housing, whether it's transportation, you name it. All those pieces have to be in place. To me, it's not as simple as, well, let's take $300 away from some people that are really struggling in our state. In fact, if you look at our unemployment rate right now, it's about the same as it was before the pandemic. So I'm not sure it's the answer to the question. I think there's kind of a gut level thing that we need to somehow punish people that are unemployed. I'm very leery of it, let's put it that way, because I do not think it's the answer, and certainly isn't the only answer. Anything else for the good of the cause?
Donators, I wanted to ask a little bit on COVID-19 also response, as multiple counties, municipalities are kind of making changes to mask mandates. Can we make a comment on kind of how you're feeling on that? Is it too soon? Are we in a good place to do that? As many are changing up within the next 2 weeks or so?
Yeah, that's a great question. The CDC's recommendations are clear in that they're following the science, and we're making such good headway as a state and as a country, and we've been leading the Midwest, or very close to leading the Midwest in getting shots in arms for weeks now. And I attribute that to people wanting to get the shots, but also our ability to do the right thing and get it to the right place at the right time. But so things look like we're headed in the right direction. Obviously, in certain circumstances, mask wearing will still be required, whether it's in prisons, hospitals, or whatever. And also, I think there will be people that are fully vaccinated that want to continue to wear a mask. God bless them. That's one way to move into this new world of the past. But so I think it's the right thing. I think it was the right step in the right direction. We've made a lot of progress. We've got a lot more to go. I will tell you that I think it is not going to be easy getting people who have historically been not part of a healthcare system, or frankly haven't paid attention to the pandemic, to now get a shot. That's going to be a real challenge for us, but we will continue doing that. But I think this is a step forward, especially as it relates to those of us who have been vaccinated. We are safe against it by a very high level of efficiency, and so I feel comfortable with the decision.
Last question?
I guess just clarification, so this $1 billion proposal for the expansion of Badger Care, does that have to pass then before the other package of economic development would kick in?
It's a package. It's a way to fund those real important projects.
Okay, so the two are tied together?
Absolutely.
Okay.
And can you do something to get Brewers to get some more hits?
Working on it.
Sorry. All right, thank you very much, everybody.